Hello, I am Dr. Mirela Cherneyanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Welcome back to part 5 in this fertility series. And today I would like to discuss the role of endometriosis in infertility. Now, I would not want to discuss everything there is to know about endometriosis. I promise I will come back on this later. There is a podcast that I can dedicate, probably a little bit longer than this one, to talk about endometriosis. This is why I want to dedicate a podcast episode to endometriosis and infertility. The truth is that endometriosis is underdiagnosed and underappreciated by many physicians and by many patients. Just as a statistical fact, it's important for you to know that anywhere between 5 and 10% at least, possibly more, of all women suffer from endometriosis, which is estimated to also exist in about 50% in all the women who are unable to conceive and suffer from infertility. So think about that. Only 10% or 15% of women max have endometriosis, but of all the women that have infertility, at least 50% of them have endometriosis. So why is endometriosis bad for your fertility? Well, because it can influence fertility in many ways. By distorting the anatomy of the pelvic organs, especially the tubes and the ovaries. By creating adhesions and scarring around the fallopian tubes. Through inflammation of the pelvic organs. And by altering your normal immune system functioning, which is crucial for the newly formed embryo's survival and implantation. And also through changes in the hormonal environment of the eggs. And last but not least, by impairing the actual process of implantation of the embryo, mainly by altering egg quality. So you're like, what? Endometriosis and egg quality? Yes. Let me explain a little bit more about each one of these mechanisms. First, how does endometriosis distort the anatomy of the pelvic organs? Well, it is necessary that just about here at the beginning of this episode, I'm going to take a few minutes to explain a little bit about what endometriosis is, maybe because you've never heard of it. Many people do not know, do not understand, or grasp what exactly is happening when a woman has endometriosis. So simply put, endometriosis is when the uterine lining cells, which are called endometrium, and which only exist inside the uterus, for some reason, and at this point in modern medicine, we do not entirely know how, these cells spread outside of the uterus, a little bit like a cancer, but it's not a cancerous condition, and develop what we call endometrial-like lesions or endometriosis, all over the pelvic organs of a woman, including the appendix and organs outside of the pelvis. It can occur in any part of the body. The bladder, the intestine, the umbilical cord, the ureter, the chest, the lung. However, the two most common locations for endometriosis are the ovaries and the uterosacral ligaments. Well, everybody knows where the ovaries are, right? Hopefully, if you don't know, just Google where are the ovaries and click on images, you will see. But the uterosacral ligaments, many of you probably never heard of. These are, very simply put, very thick bands of connective tissue, it's a ligament, that support your uterus inside the pelvis. They literally come from the base of your uterus and extend all the way to your sacrum, the bottom of your spine. There are other ligaments that suspend the uterus in the front. The uterosacral ligaments suspend the uterus in the back. The ones that suspend the uterus in the front, they're called the round ligaments. And then the uterus is also suspended right in the middle by other ligaments called the cardinal ligaments. But keep in mind that the uterus is suspended in a normal position in the pelvis because there's an equal pull between the anterior and posterior ligaments. So the ligaments that support the uterus on the side, those are called the cardinal ligaments. They connect the sides of the uterus to the pelvic bones on each side. And within these ligaments, we have the blood vessels that feed the uterus. So I took this small detour about the ligaments so you can understand the position of the uterus in the pelvic area. It's also very important for fertility, but we're not going to dig into that now. Now, we don't know exactly how endometriosis happens, but there is a suspicion that a couple of factors are necessary to be present. And one of them is retrograde menstruation. This is a really old theory because it was observed that the blood during the period, instead of flowing down through the cervix and vagina outside the body of a woman, the blood would actually flow backwards through the tubes into the abdominal cavity, carrying with it, transporting these endometrial cells, which can implant in a woman that either has a genetic predisposition to it or has an auspicious environment, likely immunologic in nature, and now endometriosis develops outside the uterus. The truth is, many women, maybe all women, have retrograde menstruation at some point in their life, maybe a couple of cycles, maybe a lot of cycles. We don't know that. But not all of them have endometriosis, very few of them. More to talk about causes of endometriosis, treatments, etc. in the actual endometriosis episode that I will do in the future. But for now, let me stick about talking how endometriosis affects fertility. Now, these endometriosis implants develop all over the ovaries, the tubes, the pelvic wall. They form behind the uterus, on top of the uterus, in front of the uterus, on the sides of the uterus, on all the ligaments that surround the uterus. They have a variety of forms and shapes and appearances. But these lesions, what you need to know is that unfortunately, they create a lot of inflammation around them. Once a woman develops these endometriotic lesions, for whatever reason, then the inflammatory process that develops from these lesions makes the surrounding tissues stick together, creating scarring. Unfortunately, this process can damage the fallopian tubes, can kink them, can create a lot of inflammation around them, closing their fallopian tube opening towards the ovary, which allows the egg to be grasped. And the very strong inflammatory process developing around these lesions could actually alter the position of the uterus inside the pelvis. Because sometimes the scarring and the stickiness of the tissues together, because of the inflammation around these lesions, the bowels are sticking to wherever the lesions are. So you have bowels stuck to the uterus, you have the bladder sticking to the uterus. Everything is sticking together in a big mass, which obviously will create issues and will create unsurmountable obstacles on the egg's journey to the uterus, if the egg is even viable at that point. Another thing you should know about endometriosis is that it alters the immunity of the environment where the egg and the sperm meet. It alters the immunity of the environment where the embryo needs the implant. Now remember, endometriosis is a chronic inflammatory condition. And a woman with endometriosis has altered immunological responses. There's a significant amount of research looking into how various immune cells work and what the immunological responses look like for women who have endometriosis. What you need to understand is that these endometriosis lesions that spread in a few places within the pelvic organs, mainly on your ovaries, around the tubes, and the back ligaments of the uterus, what you need to take home from these lesions is that they are very toxic. They are toxic for the egg. They are toxic for the sperm. Remember, there's so many conditions that have to be just right for the egg and the sperm to meet and create a fertilized egg, which will develop into our embryo. And it is impossible to have a delicate egg and a fragile sperm meet, create an embryo, and allow that embryo to survive in toxic conditions. Probably the reason why infertility is such a big issue for women with endometriosis. The most concerning aspect of this infertility situation for patients with endometriosis is that they are unable to generate good quality eggs. This reduces the success rate of both natural conception and assisted reproductive technologies. So the egg is released by the follicle during ovulation, but before it is ready to be released, the egg needs to be grown and nourished to the point of a mature egg. Now, the cells surrounding the egg, let's call these the egg's nanny cells. These are also called follicular granulosa cells. But for you to remember is that this egg has to be nourished by some cells, and they're the nanny cells. Call them the guards that accompany the egg as they grow in size. Now, during its cellular development, the egg for the first 14 days relies heavily on these granulosa cells to communicate with each other and work together to sustain, promote, and allow egg development and maturation. And recent research has demonstrated that the presence of endometriosis lesions disrupts the energy metabolism, the apoptosis, which is normal cellular death, and then the steroid hormone production, which is our sex hormone production in these granulosa cells, in our nanny cells. It is lowering our egg quality and is severely limiting patients' reproductive hopes. So endometriosis is bad for the eggs because it interferes with these surrounding cells around the egg called the granulosa cells and is very toxic for them. There are inflammatory, fibrotic, and oxidative processes. So there's inflammation, fibrosis, which means scarring, and oxidative process, which means generation of toxic free radicals. All of these are caused by endometriosis, and they can clearly harm a patient's ovarian reserve. When endometriosis is located to the ovary in particular, it can have a direct impact on a woman's ovarian reserve. In the ovaries afflicted by endometriosis cysts, which we also call endometriomas, the number of primordial follicles, the early follicles that are recruited to generate the mature follicle, the more primordial follicles, the better. And the AMH level, the anti-Mullerian hormone test, I talked about this in a previous episode. These two things, the follicles and the AMH level, are much lower than expected when a woman has endometriosis on her ovaries. Whereas the opposite, the number of atretic follicles, follicles that are dying, and primary follicles, very early follicles, are increased. So we have less ability to produce mature follicles because the follicles get stuck in these early stages. Now, a few explanatory words about the eggs, because I used a couple of big terms here. An atretic follicle is an ovarian follicle that began to mature but did not become the dominant follicle and has involuted or will die. Now, let me explain the primary follicles. During the process of the egg development, we start with primordial follicle. These undergo a series of critical changes. They first change into a primary follicle, then later into secondary follicles, then they become tertiary follicles or antral follicles. And at this stage in development, they now become dependent on our hormones, particularly FSH, follicular stimulant hormone. Again, stimulates follicles to produce eggs, which can cause a substantial increase in the growth rate. Once the eggs get to this antral phase, which is what we can measure on day 3 of a period, how many eggs you have that are visible, those are your antral follicles, right? The late tertiary, so we go to antral follicles, Then FSH starts stimulating them. They start increasing. They go into late tertiary follicles or pre-ovulatory follicles, which will eventually become one of them, maximum two, will become ovulatory follicles. They will rupture, release the egg, ending the follicle, and then the egg growth phase is done and it culminates in ovulation. Now, the endometriosis affecting egg quality could be because endometriosis causes a lot of inflammation and oxidative stress. These two processes can lead to the recruitment of dormant primordial follicle, so it recruits them into the growth tract. However, because of the presence of endometriosis, there's ovarian fibrosis, which affects the ovarian blood flow, the blood supply. So what happens is that the recruited follicles cannot get enough nutritional support. And instead of evolving, they enter this atresia state. They involute and die. So there's a vicious cycle that continues on and on due to this inflammation caused by endometriosis. And eventually all these eggs get recruited and recruited and recruited and keep dying and dying and dying, resulting in a decreased ovarian reserve and egg quality. Now, the most obvious impact is that endometriosis patients that seek fertility treatments, it's very clear and studied, they have a lower egg retrieval rate, they have a lower egg fertilization rate, and a much lower number of final available embryos and lower high quality embryos, ultimately leading to a low live birth rate of all IVF cycles. The ovarian damage from endometriosis is more severe as the disease progresses. And according to lots of research, compared to normal women, the fertilization rate of the eggs in endometriosis patients is lower than for women who do not have the disease. So endometriosis is toxic for the eggs. Now, there is another mechanism through which endometriosis creates serious infertility. Keep in mind the main symptom of most endometriosis cases, painful sex, can be a serious impediment on a woman's fertility journey. I talked about this in the previous episode. Painful sex is a major barrier to normal conception. If a woman suffers from not just painful sex, but has terrible painful periods, painful bowel movements around the period, painful bladder pain, bloating, pain and cramping between her periods, heavy periods, all these symptoms will impact her sexuality, will make her feel less inclined to be intimate with a partner, leading to simply avoiding sex. So not only is endometriosis bad for our eggs, it's bad for our tubes, also bad for implantation in the uterus, but endometriosis is bad because it might not allow a woman to have normal sex. So we talked about the mechanisms for endometriosis. What can we do? Let me end with what can we do? Is there fertility hope for women who have endometriosis? And the answer is yes. Well, first and foremost, how about surgery? Just like cancer, and again, this is not cancer, but it kind of acts like cancer, it can be at least temporarily relieved by surgery. And many women who are in the phase of, I want to get pregnant, I'm ready, if they suffer from endometriosis, surgery can give them the best results and the best hope to achieving pregnancy naturally. Now, what about surgery? Well, an experienced surgeon can remove all the endometriosis lesions during a laparoscopy. By doing that, it can eliminate, heal the toxic environment that characterizes and causes all those inflammatory processes that we talked about for women with endometriosis. Now, the surgeon needs to be very careful with the ovarian lesions because the aggressive removal of an endometriosis cyst called endometrioma can actually lead to egg destruction. And during the removal of the cyst, if there's aggressive cauterization done at the base of the cyst, many eggs could be inadvertently destroyed. So hopefully, if you choose a surgeon for endometriosis, it's got to be someone that specializes in that knows how to deal with it, that knows how to be careful, and will respect your ovaries. and tubes. Now, how about progesterone? Well, addressing the inflammatory processes involved in endometriosis by addressing the hormonal balance required for egg survival with progesterone, or by addressing the normal regulatory mechanisms of the immune cells I mentioned earlier with an anti-inflammatory diet, exercise, and nutritional support, all these things, a woman can conceive or be very successful achieving a live birth with fertility-assisted treatments. Let me talk about progesterone a little bit more. What you should know is that progesterone and progestins are two very different hormones, and they're very important in endometriosis, both of them. Progesterone is your own natural hormone produced by the ovary after ovulation. It allows for implantation and it allows for pregnancy to progress until 10 to 12 weeks. You cannot get pregnant or have a progressing pregnancy without progesterone. We can use progesterone, oral creams, injections to balance your estrogen and promote fertility. And we can use progesterone to help with symptoms caused by endometriosis, pain, heavy periods, etc. However, it takes time for the progesterone to reverse the changes and to act on these lesions. And most women expect relief in one cycle. Now, what will give you that, which is very effective to treat endometriosis symptoms, are progestins. The progestins are a class of synthetic products that have different names, like levonorgestrel, etonogestrel, desogestrel, norethindrone, Provera, etc. Now, these are not progesterone. These are progesterone receptor disruptors and blockers. They connect with the cells that have the progesterone receptors and stimulate that receptor aggressively, mimicking progesterone actions on the cell in a way that is not physiologic. Whereas progesterone stimulates fertility, the progestin drugs are fertility blockers. They are contraceptives. They have a very strong effect on thickening the cervical mucus, making it impenetrable to the sperm. They thin out the uterine lining to the point where implantation is no longer possible, which is good for the woman's periods. And they directly inhibit ovulation by suppressing the maturation of the egg. So, progesterone is good, progestin is bad for your fertility. Progesterone is good, but progestin can be excellent for symptom control in endometriosis. There are many side effects and things that come with the use of progestins. We'll talk more about that in the endometriosis episode. Now, how about estrogen? Well, addressing estrogen dominance with supplements can be very useful, like calcium D-glucarate, a supplement that ensures healthy estrogen elimination and keeps a woman from being estrogen dominant. Now, you might have heard a lot about estrogen dominance lately. It is talked about a lot. The truth and what matters is that estrogen is your most awesome hormone. You cannot get pregnant without a healthy estrogen production. And here's the but. Too much estrogen will inhibit the FSH, which we need to drive follicular growth and egg development. So too much estrogen is bad for fertility. Now, where would all this excess estrogen come from? Well, I had a whole episode dedicated to that at the beginning of my podcast launch last year. Please go visit that. It's easy to spot. But let me recap for you what I said in a previous episode. We get too much estrogen from too much fat tissue. Obese women have usually more estrogen than thin women. Too much stress. It produces excess cortisol, which can inhibit progesterone. Too much alcohol will inhibit the normal liver cleansing of estrogen. Poor liver function, fatty liver, and sluggish liver is underdiagnosed and underappreciated in many women. And last but not least, exposure to endocrine disrupting chemicals, man-made chemicals that alter the functions of our endocrine and fertility systems, causing various health problems by interfering with our estrogen production, with our estrogen actions, with our estrogen elimination, etc. The chemicals, these disruptors, they're everywhere you look, in everything you touch, maybe in everything you eat or drink. They are everywhere in our environment, and they are in many, if not all, the products we use in our daily lives. Plastics, pesticides, personal care products, laminate floors, carpets, furniture, mattresses, the list goes on and on. Please review my episode about endocrine disruptors that I did, I think, when I was talking about the uterine cancer. So how about a detox for endometriosis? The answer is yes. If you're stuck on your fertility journey, you have endometriosis, it's unclear what the problem is, but you have fertility challenges, please try a medical guided detox. Not a fasting, juicing detox, but a medical grade detox. I also talked about this not too long ago in a past episode, so please go revisit that. How about gut health? Well, yes, that's very important in endometriosis. Your intestinal health is absolutely crucial, and a healthy intestinal regimen with a super clean diet, a microbiome support can help a lot. So consider a gut restoration protocol. Speak to your functional medicine doc or call us. We can do some testing and advise you on what supplements you could use. How about your immune system? Yes, maybe a series of IV vitamins with vitamin C, zinc, glutathione, B vitamins can help revamp your immune responses and help you deal with this immunomodulating dysfunction that is a key and core component of endometriosis, and perhaps help your mitochondria promote better egg function. Now, there are many other options outside the medical realm, like acupuncture, energy healing, Reiki, other forms of energy, using infrared saunas, exercising, special exercises like yoga, and practicing certain yoga poses that promote fertility. All of these are part of your fertility journey, and you should definitely take advantage of all of them. Now, I hope this episode was helpful. If you are or you know someone with possible endometriosis and that someone is stuck in their fertility journey. Now, keep in mind that as long as you have eggs, as long as you have a uterus, there's always hope for conception and a live birth. Modern medicine can work miracles, and traditional Chinese medicine, acupuncture, and herbs can be successful where modern medicine fails. So do not give up hope. I will finish next week with this series on fertility, so stay tuned. There's a little bit more to come. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.